Hello, everyone. Thank you all so much for joining the American Heart Association and our conversation around nutrition. Today our goal is really to explore the role of nutrition in the school systems. Currently, what is the nutrition securities in the landscape around the United States, and then really improving nutrition for our students and your employees. And so we're excited to have this great dialogue with each of you. Please ask questions along the way in the chat box. We have allowed time to answer those questions at the end of the call. And so please add those to the chat, and we'll let our dear friend Jessica, who is joining us today, answer those questions at the end of today's call. And so I'm excited to introduce you to Jessica Donzie Black, who is our National Vice President of the Community Health of the American Heart Association, where in her role, she works with communities across the country, collaborating to achieve and improving the health and well-being of not only our students and our teachers and employees, but all Americans across the country. Prior to joining the American Heart Association, Jessica was the director of the Kids Safe and Healthy Food Project, which was a joint initiative with the Pew Charity Trust, along with the Robert Wood Johnson Foundation, where she led the research, the communication, and advocacy work focusing on children and nutrition. And so today she's going to be a fantastic speaker. She also has done past work, including serving as the National Director of Healthy School Program for the Alliance for the Healthy Generation, and was the very first executive director for the Campaign to End Obesity. As a director of the Obesity Initiative, alongside with the American Heart Association, she managed the National Nutrition Policy for the American Academy of Diabetes, which also was a health policy fellow of Senator Jeff Bingham, and a clinical nutrition therapist for the DuPont Hospital of Children. And so Jessica is a dietitian with a bachelor's degree in science from the University of Wisconsin, Madison, and also has her master's degree in public health at the University of Maryland, College Park. She lives in Arlington, Virginia, with her husband and her 4 young children. And so we're so excited to have you here, Jessica, with us, and can't wait to hear the great dialogue and questions at the end that y'all may have. So Jessica, I'll turn it over to you.
Awesome. Thank you, Paisley, and thank you everybody for joining. As a parent of 4 school children ranging from elementary to high school, I am extraordinarily grateful for all that you do every day, and can only begin to be aware of the work and the stress and the time constraints that you have. So really appreciate you taking a little bit of time with us today to talk about the role of nutrition for both students and staff and where we are. So let's peek a little at what our goals are for today, so you know what you can expect in our short time together. We're going to talk a little bit about the role of nutrition in promoting health and learning and why it's so critically important. We're also going to take a look at the nutrition landscape. So where are we? What are the opportunities? What are the challenges? And then what role can schools and school systems play in this? Schools play a critical role in nutrition, as you well know. And so we want to talk a little bit about where those opportunities are for moving forward, and then pointing you to resources, because obviously in the short time we have together, we aren't going to get through everything. That said, as Paisley noted, please don't hesitate to use the chat box. We will certainly try to answer any questions we can in our time together today, or send follow-up as needed. So why focus on nutrition? Let's just start there. There's a million issues that we could be focused on, and today's news, like so many days, really points to that stress and challenge in managing schools today. And so, we think of all that you're managing and thinking about, and the Center for Disease Control and Prevention, or the CDC, as we've all come to hear about it a lot, as well as ASCD and others, have really come together around this whole school, whole community, whole child approach. And that idea of really thinking about our students, and truthfully, we can think about our faculty and our staff in this way too, in that holistic sense, that ultimately, if we want the best academic achievement, we need to be striving towards the best mental and physical health and well-being. And you'll note that nutrition has its own box in the WISC model, and that's because it plays such a significant role in this. So, why specifically, right? If we dive in a little bit more on nutrition, what is that role that it plays? Well, when we look at the kind of congruence of research that's out there, and a meta-analysis specifically that was done looking across the landscape, what can we summarize? Does it really matter? Sure, intuitively we think, eating healthy is probably really important, but the bottom line is what research shows us is sort of 3 categories of importance. One, that having a healthy, balanced diet helps with academic performance. It improves brain capacity, it maximizes our cognitive ability, it helps us focus, it helps us stay in school, which obviously is critically important, particularly now that in so many cases there's that opportunity to be in school. It's connected with kids being there. So it's really, so healthy food leads to better outcomes. On the flip side, we know that too much less healthy food, that getting a lot of food that perhaps isn't contributing to our cognitive development or is kind of distracting us from the nutrients we need, can actually have a negative impact on performance. So it's not just, gosh, we need to make sure we get the good stuff, but we sort of need to make sure we're getting the right balance and variety so that we can really be at our best selves. But then the third piece of the puzzle, and something that I think has become particularly evident in the past couple of years, given the challenges faced, is that food insufficiency or food insecurity also has a tremendously negative impact on outcomes, be those work outcomes for staff and faculty or student outcomes relative to academic growth, concentration, focus, et cetera. So really thinking of this holistically through the Heart Association lens, we often refer to nutrition security, which is food security, making sure people have adequate and sufficient food that they can count on in order to meet their needs, and also nutrition, making sure that that food is at the quality that is going to be necessary to prevent chronic disease, to manage challenges, and to really be their best and healthiest self. So if we look at the Youth Risk Behavior Surveillance survey from just the year prior to the pandemic, so 2019, and certainly it'll be interesting to follow up, correlative evidence. So we can't argue this is cause and effect. You know, we don't know which side is the chicken and the egg, but, you know, kind of important notation that those students who are healthier eaters are also better students, right? And there's lots of reasons for that. It isn't, like I said, necessarily cause and effect, but worth noting that when we look at that, the data that those students self-report, you know, those high school students with the most A's are also the most consistent breakfast eaters. And, you know, those high school students with the most A's also were the most consistent fruit and vegetable consumers. So, you know, it's one more piece of the puzzle that reinforces that this is important, whether we're thinking of health outcomes or thinking of academic outcomes. And side note, academics is one of the key drivers of health over the long term. So they're really synonymous issues that we are best when we work on all of them together. So given that nutrition is important, it begs the question, sort of, what is the state of nutrition? Where are we relative to our youth and adults? And what can we be doing moving forward? So when we look at the current state of nutrition, unfortunately, it's not where we wish it were. About 14.8% of households with children are food insecure. So about 1 in 10 households overall, but a disproportionate number of those with children. And if we dive into that data a little bit more, what we also find is that an even higher percentage of households with single parents are struggling with food insecurity. And so that means many students who are struggling, be it at school or at home, are facing that challenging burden of not necessarily having sustainable, predictable, healthy food available on a regular basis. So that's the context that we have to look at nutrition, is to make sure that we're thinking about it in terms of access and adequacy and quality. And when we look at access and adequacy and quality, we see that the vast majority of youth and adults don't get the recommended amounts of fruits, vegetables, or whole grains. But on the flip side, many do get far too much excess sugar, fat, and other things that in small portions may not be bad. It's not a good food, bad food. But if those less nutritive calories are supplanting the healthy foods, they're not going to get the benefits that they need. So the current landscape is lots of people struggling with food security, limited access and affordability. Regardless, even more people struggling to consume healthy foods and often relying on less healthy options. So what is healthy nutrition? If we were going to try to correct the state of nutrition, let's all sort of level set on what that is that we want to be trying to achieve. So when we think about healthy nutrition, you know, nutrition is an interesting topic. And I will say, as someone who's been doing this for almost 30 years, everybody eats, right? So on some level, we all have a little bit of expertise in this arena. And we read about it all the time. It's on the news, it's in magazines, it's in social media. Nutrition is something that people try to sell, and they try to buy, and they try to hope for, and they try to make happen. And it's tricky because we have to eat every day, and we all have stressors and challenges that influence food. One of the primary drivers of what we eat is what we like, right? And what's available to us. And that is absolutely normative human behavior. So if we want to be the healthiest, we have to think about how can we kind of set ourselves and our staff and our faculty and our students up for success? How do we make sure that what is healthy is also what's available and is what is easy? Because those things are going to be really important. And ultimately, what is delicious? So if we had to think like, gosh, what are we trying to focus on? Sort of what's the goal here? Well, the Dietary Guidelines for Americans sort of lay out 3 major groups of goals. And then under that, we can talk about, okay, what does that really mean? How do we operationalize that? So the bottom line is, without kind of looking at any trends or anything really specific or kind of popular today, we got to focus on meeting food group needs with nutrient-dense foods and beverages, meaning there's a reason that from the time we were little, we talked about different types of foods, right? Fruits, vegetables, grains, protein, because they come with them important nutrients, be that protein, be that carbohydrates, be that vitamins or minerals or other nutrients that are critical to growth, development, to thinking, to functioning, to staying healthy. So the key there we often talk about is balance, right? We need some of lots of things. That said, we can only consume so much. So to stay within calorie limits is really personal. You know, if I am a competitive swimmer, as often gets talked about, right, post-Olympics, and as we look to the next Olympics, or a high school student who is growing, who is fit, who is incredibly active, my calorie limit may be very high, but ideally I still need to get all of my nutrition in that space. I have a little more flexibility, right? If I can eat 5,000 calories a day and be healthy, that gives me a lot of room to get that nutrition. But if I am not that active, or I'm at a different place in growth, or I'm not, kind of that tall, or whatever the case may be, my total calorie needs may be much less, but I still need to pack a lot of nutrition into that. So then it becomes more important for every single food I eat, right? When we talk about nutrient-dense foods, those are the ones that have as much of what we do need and as little of what we don't need, so that what we're sort of adding from a discretionary level isn't excessive. And in order to get there, we sort of need to limit these foods that tend to have more of what we don't need without what we do need. So it's sort of calorie dense as opposed to nutrient dense. And that means beverages high in added sugars, or foods high in saturated fats, sodium, and then alcohol being another kind of non-nutrient that can be a contributor to our food. So the bottom line, if I'm operationalizing that and I'm thinking about, okay, so how do I want to improve either my eating, my family's eating, my students' eating? It's going to be more fruits, more vegetables, more whole grains, lean protein, lean dairy, vegetable oils. Regardless of if we're talking about preventing cardiovascular disease, preventing cancer, type 2 diabetes, or just general health, that same general guidance applies. So, and as simple as that sounds, we recognize it's also really complex, because we have to figure out how to do that in the context of people's life and preferences and time. That also means less of the things that don't carry with it that nutrient density, less candy, less sugary drinks, less desserts, less fried foods, less salty snacks, and keeping those portions congruent with needs. So what is too much and what is too little is personal, is individual. And that's something we have to think about just relative to, how do we make it available for people so that they can get what they need without there necessarily being excess. Okay, so if that's the goal, that's healthy nutrition, and we know we aren't there, then it begs the question, what can schools do? Where do schools play in this space? Well, first and foremost, it is critically important to recognize that schools play an unbelievably important role in the nutrition safety net. And I think that became more obvious to people than it ever had been during the past 2 years, that many people did not realize how much young people rely on schools for their core nutrition until schools had to be closed or students were able to get there. And schools, all of yours included, went to unbelievable means in order to make sure that food could still get to kids. Fortunately, there were some flexibilities issued by the United States Department of Agriculture and Congress in order to respond to the fact that schools were closed and change the rules a little bit so that foods could be served more broadly to students, to their families, without necessarily checking all the census the same way we had to do previously, not having to have congregate meals where we weren't allowed to do that for public health reasons, et cetera. But it really shone a light on the critical importance that schools play. That said, the reason I included the chart that shows the number of meals served is it's important to note that despite the unbelievable effort that school districts put into making sure food could still get to families, we still saw a significant drop in participation in school meals and in numbers of meals served in 2020. So what you can't quite see it, along the bottom are all the years from 1971 to 2020. And the red line is indicative of the percent of youth who were receiving free or reduced price lunches. So those youth whose meals were subsidized even more. Every meal is a little bit subsidized. You get reimbursement from USDA for every meal served. But for those students who qualify for free or reduced price lunch, or for everyone, if you've been operating as a universal free or community eligibility site, are higher. And as you can see, there's been an increase in those meals that are offered at free or reduced price. That increase continued last year, even though we saw the total decrease. So we know that there was a gap, right? Students who had previously been relying on school needed to look elsewhere. Fortunately, there are increased flexibilities, and fortunately, USDA has extended those to the end of this school year, so June 2022. But now there's a lot of discussion about what's moving forward, and the hope is that we can use this as an example, really continuing to offer universal free meals, to continue to get that reimbursement rate for all students so that they can eat together without stigma, with healthy foods. By definition, school nutrition needs to follow certain nutrition standards. And a lot of school districts have done amazing work to serve appealing, delicious meals that really meet those needs. So if we dig in to those opportunities a little bit, and we start kind of look across the day at the role that schools can play, we'll start with breakfast. Got a little preview, so we'll start with breakfast. So what we know about breakfast that is interesting is at times of standardized testing, right? Or at kind of other things where the school is placing a particular importance. Very often, at least historically, perhaps in schools that don't have school breakfast programs, a note would go home to parents that would say, this week our students will be taking this exam. Please make sure they're at school on time. Please make sure they've had a healthy breakfast and they're ready to learn or ready to perform. That said, they need that same start to the day in order to learn throughout the year. And so to the extent that we can think about how to make breakfast more available, it often has positive benefits, be it in behavior or academics or teacher-student interaction for the teachers who are bringing their granola bars and they have them in their desks when kids are hungry, they're handing them out. It helps to kind of calm that. One way to approach that is universal and community eligibility, meaning leveraging whatever one can in terms of making things more universally available so that there doesn't have to be individual numbers taken, individual head count, et cetera. Some other things that have been really successful for schools, and likely many of yours, are things like grab and go options. A lot of this got practiced during the pandemic because we weren't allowed to eat in cafeterias. We had to go in dispersed areas. But even prior to that, there were schools who had used this as an opportunity to make sure, those students getting off the bus who have to go straight to class, were not here early enough to eat breakfast, they can still grab the meal to go. Similarly, the concept of breakfast after the bell, and typically that's actually after the first period. We see this being particularly effective in places like high schools and middle schools, where sometimes students really don't necessarily feel like eating as early in the day. They're kind of shifted. Sometimes school starts really early. And it's after that first period that they're thinking, oh, now I'm hungry. But also just depending on your bell schedule and your meal schedule and your space available, lunch may not be until 1 o'clock in the afternoon. So having that opportunity for grab and go between classes is often a great opportunity to make sure the students are getting what they need. And then also opportunities within the classroom, be it allowing eating in the classroom when appropriate, or often in elementary schools, actually doing the service via cart into the classrooms. And making sure we're working with facility staffs and teachers so that it's done in such a way that doesn't create a lot of mess, so that everyone can kind of feel good about it and it's integrated into the day. So to the extent we can make breakfast available, but then also the other piece of that is communicating with parents that it is available, and particularly if it's available to everybody, taking that burden off of families and letting them know it's there, they can participate in it, so everyone's on the same page. That brings us to lunch. And the vast majority of schools, particularly public schools, do offer lunch and participate in the school lunch program. So likely lots of experience with this. But school lunch is an interesting thing. And very often when I work with school nutrition directors, one of the things we note is that they literally run the biggest restaurant in town. Like in almost no community could there possibly be a restaurant, a facility that serves as many meals to as consistent and picky an audience as school nutrition has to do. It is the hardest job, right? To make sure that people are happy. And ultimately, we often hear from the people who aren't happy. So unfortunately, school lunch doesn't always get the credit it deserves for being so unbelievably important to kids' health, and for a lot of the adaptation that school nutrition has done to serve really healthy foods. Even if people, they look and they say, oh, it's chicken nuggets and fries. Well, those are, lean, baked, breaded with whole grains, and the kids wouldn't know it. And so there's been a lot of positive work done to make sure we're serving healthy and delicious foods. To the extent we can leverage community or universal eligibility, right now, because of the pandemic, any school can be serving free meals to their students. And so a lot of schools are exercising this, which is fantastic. The hope is that that can be continued. That will be a regulatory decision / congressional decision that gets made later in the game. But the bottom line is some schools would still otherwise qualify for universal eligibility or leveraging what they call community eligibility. If you have a high enough percentage of students who qualify for free lunch, you can serve free for everyone. So it's to the extent we can take advantage of that, it's a great way to eliminate stigma, maximize participation. That's also great from a production standpoint, because the more mouths you're feeding, if you talk to your nutrition director, the more consistently, the more mouths you're feeding, the less waste we have, and the more you can maximize sort of staff time relative to food time. When you hear feedback about school nutrition, right, and when some people who haven't been in a cafeteria in a really long time are often kind of thinking back to their own experience, sometimes they'll comment on, oh, kids throw things away, there's such waste. There's actually been a lot of interesting studies done in the past years that have shown there has not been an increase in plate waste. And in fact, there's no more waste of school food than there is from packed lunches. So it is not to say that it's a school food thing. In many cases, what the studies have shown is that there are other factors influencing whether kids eat, the biggest one being time. So to the extent things can be arranged so that kids can actually have time to eat, that's critical. That may be having multiple lines or trying to make things more efficient on that front. It may be spreading out lunch periods if possible. We recognize that so often the gym is also the cafeteria, particularly in elementary schools, or students may need to eat outside in this current environment, and we need to disperse them. We may be doing grab and go because lines are long, but kind of working that out, particularly young people need more time. And also if we can serve food in a way that is the easiest to eat without it just being snack food, right? So you can still serve apples. Sliced apples get consumed at a far higher rate than whole apples. I sometimes have a picture in the slide of when one of my kids was at that age where like they were literally missing all of their front teeth, right? Whole apples aren't going to get consumed very quickly, whether you're at home or at school, but chopped up fruit, chopped up vegetables can be really effective. Choices within limits. So choice is important. When we've surveyed parents, one of the things they say is, I want my kid to have choice. I don't want them to be hungry. But that said, the choices can all be healthy options, right? So if we can have multiple fruits or vegetables as options, it still encourages that same healthy eating without kind of defaulting to other things that may outcompete the healthy foods, but aren't necessarily as nutritious and won't lead to the best outcomes. And then incorporating education and promotion, we can make it a learning opportunity in the context of the day and have it really be sort of a practice situation where I'm practicing eating. I can do, try things, taste tests. It's a way to expand. And then promoting participation. I think being really positive about school nutrition to parents and to families is critically important. People come to the table with whatever their experience or bias is, and they may not recognize the tremendous work that has been done. This particular graphic is of a cafeteria that I had the pleasure of visiting, where they've done all of this beautiful artwork and they played music during lunch and did other things to just really make it an appealing atmosphere for the young people, and a more calming atmosphere as a result of that. And unless you've been there, right, people just didn't necessarily know that so much great work had been done. So being sure to promote that, having on back to school night, sample foods or visit the school nutrition opportunities, ask your questions, learn more so people can feel good about it can be really important. All right, so that's breakfast and lunch. That's what we do mostly in school, but the reality is we can go well beyond that. There's even a bigger role that schools can play, and many have. School nutrition, breakfast and lunch, are sort of one piece of the puzzle. There's another program out of the United States Department of Agriculture called the Child and Adult Care Food Program. Through the Child and Adult Care Food Program, schools or others actually in the community, doesn't have to be schools, could be other partners, can serve supper. They can actually serve an after-school full meal. And so particularly for students who may be at risk or food insecure, or who just have very extended days between either after-school care or tutoring or the school play or athletics, you can't leverage it as a training table per se. We can't make it a meal exclusively for athletes. It has to be available broadly. But if it's available broadly, athletes can participate. And there are some phenomenal success stories for schools expanding to include the supper program, again, getting full reimbursement for USDA. So it didn't come as a cost to the district per se, but really a value add for those students and families who then, one less thing to worry about. Any of you who are also managing, in addition to school districts, you're managing families, know how tricky that can be when you're picking kids up and rushing home, and now you got to figure out dinner. And if that piece is done, it's terrific. And in some cases, families can even be invited to share in the meal at a low cost. USDA doesn't reimburse for those family members, but often the marginal cost isn't that big. So for a small amount of money, far less than people would pay for fast food, they can participate. You can still have that family meal environment, and then I'll go home done without any dishes. So that can be a great opportunity, particularly once we get back to more comfort level with congregating and with being together. Right now, understandably tricky, although grab and go could potentially be an option. The other huge area of opportunity is summer. We recognize when schools are closed, there is typically less food available. The summer meal program historically serves about 7 million students, whereas school meals serve about 31 every day. So there's a big gap there and a lot of opportunity to grow those summer feeding opportunities, be it associated with summer schools or even sometimes partnering. A lot of times school nutrition can be the infrastructure, sort of the brains, the ordering, the pulling things together, and then can be the provider to other sites if there's other places where students are. And the bus featured is actually a bus, is a food truck, as it were, but a school food truck for summer foods to have mobile summer sites in a district. So that concept sometimes plays out. And the community hub is an emerging idea when we really think about the roles that schools can play, particularly be it in rural settings, urban settings, or suburban settings, where sometimes they are physically a hub. They're a place that people can access or have means of getting to. And so thinking about how to leverage that either during school times or outside of school times, this can also be a great benefit to faculty. So schools that are hosting farmers markets after schools. In some cases, there's been great work in high school with school business clubs, actually starting, produce shops or little pop-up farmers markets. So instead of it being necessarily less healthy options, a donut shop or something, they're selling fruits and vegetables that people can grab and go as they go home, or teachers and faculty can buy on their way out of school. And you have that win-win of practicing their business skills, but also promoting a healthy food outlet. So lots of opportunities to play a role in this space. So, as we think about this, we talk a lot about students, right? They're a huge focus, but it's also important to remember that schools have huge faculties and staff and are often also some of the biggest employers. And when we're looking at the health of teachers, there's actually not a lot of data that looks specifically at the nutritional status of teachers. There has been a lot of look at the mental health and well-being overall, and we know that even pre-pandemic, that the majority of teachers reported that they were often or always stressed, that their jobs were often or always stressful, right? It's a lot to manage. They're managing school and students, and often they have their own students at home that they're also managing. This past year being a huge exacerbation of those challenges, right? Trying to live in both of those worlds simultaneously. Finding time to plan, prepare, and eat healthy is tricky. Add to that stress in any high stress job, it's just really hard to be, to have nutrition be the highest priority. So a lot of teachers anecdotally struggle with their health and nutrition, like so many. But there are things that can be done here too, as employers and as networkers. So as we think about what we can do as school districts relative to our faculty and staff, there's a lot that leadership can do in this space. So one of the opportunities is thinking about how we can promote school nutrition among our faculties and staff. That in some cases, school meals can be purchased at a very low price point by faculty and staff. And if those school meals are appealing, there's lots of schools today who have salads or salad bars or other things, fresh and healthy foods that teachers can easily access, and making sure that that's encouraged and teachers are encouraged to participate in that. Similarly, when we think about the time that we have people's time, or that they're still giving their time, how can we incorporate things like nutrition education among those continuing education and staff workshop options? There's actually been a couple of interesting studies that have looked at the role of educating faculty and staff relative to the outcomes of students. And they've found that with nutrition education among staff, not surprisingly, that also trickles to the students, right? So students very often then have stronger outcomes relative to their nutrition understanding, just based on the fact that the staff feels a higher confidence level in those issues, even if not directly curriculum based. Another piece of the puzzle is really making sure that we're encouraging healthy environments for our faculties and staff. very often faculty or staff rooms are sort of considered the safe place, the exception. You can have anything in there, right? It doesn't matter what the rest of the standards are, that's your special place. And that's okay. We want to encourage that safe and collaborative time, but it can also be a time of health promotion. So to the extent that we're having meetings or in-services or it's staff appreciation, there are ways to appreciate that don't necessarily promote less healthy options, but rather, who wouldn't want to come home or who wouldn't be able to bring home a platter of, sliced and chopped fruits and vegetables. I always say, if you show up at a meeting and there's all fruits and vegetables, and that's what everybody eats because that's there and it's delicious. But if I have to go home and like pull open the drawer and pull things out and wash them and cut them, I'm less likely to do that, even though theoretically maybe I could do the same thing. So just thinking about how we can leverage those opportunities to actually make it easier for people to maybe make the healthy choices, get the healthy foods that they would like to have, but aren't necessarily as easy as default for them. And then thinking about that community hub option, even if not for the community broadly, just relative to the staff. So can the staff have, groceries delivered on their way home, good outside where it's safe, or a CSA delivery? Could the parking lot be a CSA delivery site? Is there an opportunity for farmers markets or pop-up mobile market access so that people can kind of have that one more convenient step that doesn't have to be exclusive to faculty, but can also be another element that faculty can leverage as they think about things. So lots of things to think about as we're thinking about how do we move from our current landscape where we do have challenges with access, we have challenges with affordability, and we certainly have challenges with consuming the healthy foods we need while sort of monitoring and reducing the less healthy options we need. How do we move from that landscape to a place where people's default, where they have more options, more accessibility, more affordability, and thus hopefully more consumption of those healthy foods, lots of opportunities there, more resources. So as we think about moving forward from today, we want to make sure to point you to some places that can be helpful. Within the Heart Association, we have a few places, and these links will come to you in the chat box, but they will also come to you in follow-up in the PDF that you receive. Healthy for Good is our sort of nutrition promotion, and actually broader than that, stress management, physical activity, nutrition. It's a great resource for staff as well as for families. It is, tips and tricks and coaching to move forward. It's recipes and examples, and it's intended to speak to a wide range of people. So certainly encourage you to log in there and pull from it any resources or plug people into it, include things in your newsletters, whatever might be helpful in terms of helping promote those healthy messages moving forward. Healthy for Life is a curriculum that is really sort of a user-friendly, train the trainer. It can anyone can kind of take it and run with it. All of the resources for facilitating that culinary education are available to anyone at no cost. All people need to do is log in and get it. And so that could be something that is offered in the context of school, after school, for faculty, as a community education, whatever it might be. Just want you to know that that resource is available, because for some people, one of the limiting factors is in fact just that skill-based learning. And it's really focused on people who would be eating with lower resources. So by no means an expectation that someone is, buying a huge number of groceries and needs fancy cooking facilities. This is really meant to be simple, quick, and healthy. Our Kids Heart Challenge tools and resources are great in terms of speaking to youth and making sure that we have those resources available, be it via classroom opportunities or for families to leverage. And then if you really want to dive in more on what schools can do relative to offering nutrition assistance, certainly the United States Department of Agriculture Food and Nutrition Services is the go-to for that, as your child nutrition director definitely knows, because they are being regulated by USDA at all times. But tremendous resources there, both in terms of explaining current regulatory environment, resources in terms of what can be done, how to do it, where to find, and even educational elements as well. So with that, I'm going to turn it back over to Paisley to see if we have had any questions.
We did. I got some private questions. So I was like, I don't know how y'all did that, but great job asking questions. But please ask any remaining questions that you have in the chat bar. So somebody asked a great question. I'm intrigued as well. When you think about the impact of the pandemic, what have you seen specifically around nutrition and the status of kids? And, have you seen any particular aspects worsen, or has there been some things that we've gotten that we're going to continue to do that are going to help students?
That's a great question. And the reality is that data is still unfolding. So there's been very limited research done on what we're calling the indirect effects of COVID in the youth population relative to health. We have a pretty good grip on what the direct impact of COVID has been relative to infection rates and consequences, but the indirect effect, what that effect has been on students' nutrition, physical activity, stress, mental health, well-being, as well as their academic outcomes is still being learned. And just as I know a lot of districts are currently doing, kind of retesting, right, to get a new baseline and to say, where are we right now and where do we need to go? From a science perspective, we're also looking at those same questions. What we can say anecdotally and from some small studies that have been done is we recognize that the pandemic greatly disrupted family lives and disproportionately disrupted family lives of people in the informal economy or people whose jobs were in the service industry who were really directly affected, such that it definitely impacted eating. To what extent the consequences are is still evolving. We know that students, on average, there seems to be increase in screen time, decrease in physical activity, and some small small population studies have shown an increase in less healthy foods during that time, which we would not be surprised to see given just more downtime and home time, and also in some cases some mental unrest and unwell being, right, in that same. So we're still learning on from a statistical basis, but the reality being it seems as though nutrition status may have worsened during this time, and certainly getting back to a more active, balanced time is going to be really important to returning children's health.
No, that's good to know. So a lot to unfold still in their future, but here's some early evidence. Somebody said our district has really leveraged all the USDA, but what sparked the interest was the supper program option. They did not know much about that. So can you explain a little bit more about that?
Yeah, so as I said, typically school lunch, school breakfast are part of the child nutrition programs or the school nutrition programs. Child and adult care food program is a little bit different. It's regulated a little bit different. Its primary audience are typically preschools, daycares, or senior centers. That's why it's child and adult care food. But there's this provision in it that allows for what we kind of call it in the Heart Association a third meal. It's another meal opportunity. It's the at-risk supper program is what it's technically called. And it reimburses for those supper meals. So that one can serve food after school. And maybe that's at 4 or 5 or 6, whatever works. Those can be grab and go, or they can be sit down and eat. So they do not have to be there. In normal regulatory times, they have to be congregate, but they don't have to be a hot meal per se. So they can be prepared and stored at lunchtime when staff is there, and then served later if it serves a benefit.
Yeah, I have a follow-up question. Tell us a little bit more about what they can do with their virtual teachers.
Yeah, no, it's a great question. So if someone is teaching virtually, and or if the question is about virtual students, right? If it's a different thing there. Right now, students who are remaining virtual still have an opportunity to participate in the lunch program. So they could still come get grab and go, or we could make that available to them. And they can still bundle it just as we could during the pandemic, such that you don't have to come every day at every meal time. One could get multiple meals at a time. So we can still have food service even with students who aren't necessarily on site, which is great. Relative to teachers, it's really important to be checking in with them around where they see their needs, their challenges, their opportunities, and making sure that we're reinforcing those healthy decision-making when possible, right? That, what is their food access? They too could be participating, coming in, getting food if that was important, or encouraging students to do that. So certainly in the virtual environment, it's trickier from an actual food perspective, right? Getting that food when you're not there to do the physical handoff, being able to make it available for grab and go at times of the day when people have access has been the backup plan in that. But then also just surveying for what other tools and resources may be helpful in helping them overcome the challenges they're facing.
They're really asking questions and digging in on children you may have some concerns on. The last question that I got so far, but please keep them coming. Great questions coming in is, we want to appreciate our teachers, but sometimes food accompanies every appreciation. So any suggestions on how to celebrate teachers, either with healthier food or without food, because that seems to be our guilty pleasure, or seems to be kind of what we lean into.
No, I love that. And I in addition to education, I worked in healthcare, and it's a similar thing where, if people are grateful to their nurses. They bring them cakes and donuts and cookies and et cetera. And it's incredibly appreciated, but often it's just not helping us be our healthiest selves. And particularly for people who are trying to manage their nutrition or trying to do things healthier, it can be really challenging. So if we want to celebrate people without necessarily making it about food, making sure we're offering affirmations is really important. That in some cases, people just really want to hear how appreciated they are. And that can be great. Offering things like, using those same resources to help people get the nutrition they may need. So be it grocery store coupons or grocery store gift certificates, so they can go get things, or, more healthy food opportunities instead of maybe, having a more traditional, I won't name any brands, provider come and bring a display of maybe less healthy breakfast options, going with someone who might bring a display of fruits or vegetables or whole grains or things that are going to be appealing, but not necessarily have that same impact. And then, and then lifting people up, like really making sure that we're talking about their successes, that we're modeling that we are saying thank you, that we're giving, notes, cards, things before there was Twitter. It can be incredibly valued by people without it necessarily being accompanied by less healthy food. So certainly providing food is great if, everyone loves free food at the meeting, but just trying to think about how to make sure that it is helping people meet their personal goals and not sort of setting them up to be sitting there thinking, oh, I really want the cookie, but I'm not gonna eat the cookie, but I should eat the cookie. So, we're not in that zone.
Absolutely. Well, Jess, thank you so much for helping us, educating us, and showing us the opportunities that exist for our teachers and our students and districts. And so thank you all so much for joining us. We will send out follow-up resources for you that Jess talked about today, along with links. And so if you have any additional questions, please respond back and we'll follow back up with each and every one of you. We appreciate and value your time, and we hope you have a fantastic rest of the day. Thank you, everybody.